And our first speaker, I'm happy to introduce Dr. James Park, who is an associate professor in the Department of Medicine here at Bellevue. So Dr. Park, we are all ready for you.
Good afternoon, everyone. My name is James Park. I'm one of the hepatologists at NYU Langone Health. We are all the faculties from NYU School of Medicine. So I'm one of the faculty specialized in liver or hepatitis or any disease pertaining to liver. It's called hepatologist. I'm very happy to be here. Thanks for inviting me. Today's the symposium. So topic is hepatitis B, and we'll discuss the strategy for protecting yourself and staying healthy if you have hepatitis B. So let's talk about the liver. Liver is situated on your right upper quadrant. You can put your palm on the right upper quadrant areas. It's about most of the liver is protected by the rib cage. Because it's a vital organ. It is largest solid organ in the body, and then has many functions, such as remove poison or detoxify medications from the bodies, and also produce a vital protein, nutrients for your bodily function, and produce bile. Bile that sometimes people vomit comes out of mouth, the greenish stuff. It is produced by the liver. Its function is aiding digestion of the food, especially fat or vitamin, fat-soluble vitamin. Also, its important immune function it is like first organ that entrapped all the bacteria or killed the virus and enhance the immune system in your body. And so, as you can see, liver has many viral functions. Without the liver, a person can sustain their life. So let's talk about hepatitis. Probably anyone ever heard about the term hepatitis? Raise your hand. Okay, very good. So hepa means liver. Titis means inflammation. Hepatitis is a liver inflammation. So how do you know whether someone has a hepatitis? And where is hepatitis coming from? Sometimes doctors can use your blood test called liver enzyme test or liver function test to indirectly sort of figure out whether a person has a hepatitis. Or sometimes doctors may have to figure out from liver biopsy looks the sample under the microscope directly to find out if someone has hepatitis or not. There's many different causes of hepatitis. Drug, toxin, autoimmune, but one of the most common thing we are seeing worldwide is viral hepatitis. So that's why I'm here for. There's 5 different types of viral hepatitis. So A, B, C, D, E, F, easy to remember, right? But for remaining talk, we're gonna focus on hepatitis B because worldwide it is the most common reason for liver disease, liver cancer, and liver cirrhosis. So let's quickly overview hepatitis A, B, C. A is typically transmitted through fecal oral, meaning someone who touched the feces, then it goes to the mouth and infect the liver. And typically it's transiently causes illness, so it doesn't cause something so-and-so-called chronic infection. Usually goes away. Occasionally, patient may get sick enough that they get to the liver failure where it requires liver transplantation. Hepatitis B and C are transmitted through blood-blood exposure. Okay, just remember that blood-blood exposure B and C, and both can lead into chronic infected state called chronic infection, where infection persists after 6 months, more than 6 months of period. Difference between B and C are following. B, more infective, highly infective. B, typically more transmitted through mother to baby. Third, vaccine is available for hepatitis B. However, there is no vaccine available for hepatitis C. This is a very important fact. So again, I'm repeating myself. There's vaccine available for hepatitis A and B. but there's no vaccine for hepatitis C. So I think it's briefly, I think it's worthwhile to talk about acute versus chronic hepatitis B. Acute is, as I said, short-term, short-lived infection. If it is adult who get infected with hepatitis B acutely, usually 9 out of 10 chance, it's self-resolved, self-remitting. This infection goes away after a couple of months. About 2/3 of patients may feel tired, sometimes yellowing of the eye. It's called jaundice. May appear, but usually goes away. 1 out of 10 patients may probably go on to develop something called chronic infection. Okay, and this acute hepatitis B has a declining because there's universal vaccination. Everyone in the United States, if they're born in child school age, they get offered to get a vaccination that prevents someone from developing hepatitis B. Chronic hepatitis B, as I said, chronic meaning infection persists longer than how many months? Yes, 6 months. So 6 months period of time. And issue with the chronic infection is there's no symptoms. No one has a symptom. If someone develops symptom from hepatitis B, chronic infection, that means a substantial portion of the liver is damaged. Perhaps patient has cirrhosis. Perhaps patient has a liver failure. Perhaps patient may develop liver cancer. Okay, so it's a silent disease. So unless the person is tested for hepatitis B, often they don't know they're infected with hepatitis B. This is the liver. So this side is a normal liver, brownish, like soft, glistering color. And this is becoming inflamed liver, laying down the scar tissue, like slightly nodular. Then lying down more scar tissue becomes cirrhosis. As you can see, liver become nodular, not smooth enough. And they feel hard. Instead of soft, feel hard. Then eventually they develop liver cancer. This middle area here, this is liver cancer right there, yeah. So, and liver cancer, unless someone is found early enough through screening, sometimes it can be deadly. But liver cancer, when it's found early enough through screening test, it can be cured with a surgery or transplantation. Now, this is worldwide map of hepatitis B. Pay attention to the colors in the map. Red area is area where hepatitis B is epidemic. Epidemic meaning more than 1 in 20 people have hepatitis B walking around on the street. The light, the yellow color is the intermediate range. Whitish area is like low risk areas. So let's talk about the red areas. This area is where hepatitis B is epidemic, where there's lots of people who are infected with hepatitis B. These are like the East Asia, like China, Korea, and then also Africa. If your family member or your parents or you are from the area where hepatitis B is quite common, like Africa near the sub-Saharan desert, or the Asia, also it can be from other areas too, but then you should be tested for hepatitis B. In the United States, yes, hepatitis B is also relatively common, more common than HIV. Why is that? Well, United States is called United Nation of the world. So a lot of people around the world, they migrate to United States, from a place where hepatitis B is quite epidemic or endemic to United States. So if you go to bigger city like New York City, Los Angeles, or the San Francisco, DC, there are lots of people with hepatitis B in the community. In the United States, there's about 2 million people who are chronically infected with hepatitis B. Things to remember is that more than 50% of those people in the United States with hepatitis B, they are foreign born. Foreign born meaning they're born. Anyone who are foreign born outside United States, raise your hand. Me, myself, anyone else? Okay. No one? Okay, good. So if you're foreign born or your parents are from the area where hepatitis B is endemic, should be tested for hepatitis B for yourself. So how much burden does it cause in the United States? Again, there are about 2 million people who are infected with hepatitis B. Is responsible for over 5,000 deaths per year. But probably this is underestimating because a lot of people, they don't report why they die. So we suspect it's much higher than that. In the United States, they do a lot of liver transplantation. Roughly about 250 of liver transplantation per year is due to hepatitis B or more. So now let's focus on how hepatitis B is transmitted from person to person. Okay? Earlier I said the Hep B is primarily transmitted through what? Blood to blood contact, right? And how does blood get exposed to someone else? Well, there's a couple of different ways. First, you need to understand hepatitis B is very, very infectious. So unlike HIV, very short-lived, outside the human body, it dies quickly. Hepatitis B is resilient. It lives more than 7 days outside the human body in the form of like a sexual fluid or blood. Okay. As I said, yes.
Is it spread by, I'm curious, sexual contact?
Yes. So let me explain to you now. It's a very good question. Why does it happen? I'll show it to you slide. As I say, worldwide, most common route of transmitting hepatitis B is mother to baby. When baby is born through birth canal, a lot of blood is exposed. Baby gets exposed to blood from mom who is infected with hepatitis B, and baby get the infection, and they don't know about it, babies, and they grow up and they develop disease. 9 out of 10 were graders. In westernized world, Europe, other place, some part of the United States, they get transmitted through blood contact through instrument. What instruments are there? You can also needle, drug user. Sometimes they share the needles, right? That's common route of transmitted virus. Or what other things you can think of blood tint instrument we can encounter in the communities? Like sometimes razor, tattoo, sometimes use the same ink or same needle. If you're a tattoo artist, sometimes use same ink, same needle. That typically they use same ink. That can be reservoir for transmitting hepatitis B. And sex, unprotected sex. The hepatitis B is very concentrated in sexual fluid from vagina or semen, and it's very highly infected. Just one shot, that's it, you'll get infected. So tattoo. You don't get transmitting hepatitis B. This is very important to remember. I have a patient who came to see me. Has hepatitis B. She was 60-year-old, but her children refused to hug her. Because thinking that they're gonna work. Their church people refuse to shake hands because they say, "Oh, you have hepatitis B. I don't want to get infected with hepatitis B." And and her husband refused to kiss her. You don't want that, right? So none of these are the ways to transmit hepatitis B. You don't get transmitted hepatitis B from kissing, hugging, breastfeeding, okay, or sharing utensil, okay, or cough sneezing. Just make sure. Mosquito doesn't transmit hepatitis B. Okay, so very important. Now, so as I said, the summary for the transmission for hepatitis B, more than 9 out of 10 cases worldwide. There are about 257 million people worldwide, 257 million. They're infected with hepatitis B. Most of them are infected through vertical transmission. Mother is giving to baby, right? And then remaining like 1 out of 10 cases or less is through some blood contact or sexual fluid contact, unprotected sex or a needle use. Okay. Nowadays, it's very difficult to get hepatitis B from blood transfusion, but prior to 1982, when they were not screening for blood product for hepatitis B. It was possible, I mean, but what are the symptoms of having chronic hepatitis B? Answer is no symptom. There's no symptoms. If you develop symptoms such as weight loss, fatigue, pain, jaundice, mean the disease has progressed substantially. Perhaps liver cirrhosis is happening, liver cancer is happening. That's sometimes too late. So it's very important to be tested for hepatitis B. So this illustrates the importance of Hep B screening, right? Probably you understand now why we have to be, and your family member or friends has to be tested for hepatitis B. Because a screening lets you find someone who has hepatitis B, so they can be treated, prevented, so they don't progress. Number two, screening lets someone find someone who is susceptible to get hepatitis B from their partner or someone else. If they are susceptible, what do? You can vaccinate the patient or person so the person does not get hepatitis B. How do you do screening? Simple blood test, 1 vial of blood test you donate. Check for antigen and antibody. They let you determine whether you have a hepatitis B or you are susceptible to have hepatitis B or you have an immunity or antibody to hepatitis B, so you're protected. So earlier I said who should be briefly say those people who are born from those endemic area of hepatitis B worldwide, or who have parents who are born from that area like Asia or the Africa or other parts of the world, they should be tested for hepatitis B. Other people include family member, having family member, immediate family member who have hepatitis B, or your partner, or husband, wife, or sexual partner is known to have hepatitis B. Pregnant female, it's mandate, it's law that all pregnant female during first trimester should be tested for hepatitis B presence. Why is that? I said the Hep B is transmitted through mother to baby, right? If you know early, you can stop the transmission. HIV infected patients. Why? Because they share the similar risky behavior, right? Unprotected sex or the injectable drug user. Hemodialysis patient, because this is a blood involved filtering procedure, sometimes it can happen. And injectable drug user. Or incarcerated people, once they're incarcerated, like prison, there is also risk factor for getting or having hepatitis B. A blood test for the hepatitis B infection is, as I say, antibody test and antigen test. Surface antigen test shows that you are infected, and antibody test shows that either you are immune to it, or from prior exposure, or from vaccinations. Just remember that. I'm not going into detail, but the simple blood test, 1 vial blood test can tell you that. Now, let's focus on the prevention of hepatitis B. Best way to protect yourself and others is what? Checking whether you have hepatitis B or not. If you don't have it, whether you have immunity or not. If you don't have immunity, vaccination. You should offer vaccination to everyone. What are the other ways to prevent hepatitis B infection? Education. You got to educate not just yourself, your peer, friend, your family members, that having correct understanding of how hepatitis B is progressing or transmitted helps. You don't want to isolate this individual from the community or your family or so. And practicing safe sex. Safe sex meaning, as I said, using barriers so that there's no exposure to sexual fluid, like semen, vaginal fluid. So using condom, or vaccinate the person so that person has immunity. Once has immunity, you can have unprotected sex. And using sterilized needles. Safe blood products, meaning screen the blood products for hepatitis B. and getting tested if you're pregnant for hepatitis B. So your future babies are protected. Okay? So everyone should get vaccinated, in my opinion, but especially the children at birth, they should, in United States, everyone is getting vaccinated for hepatitis B, typically 3-shot series, okay? And then also they get tested again during their children adolescent period before they go to college. The pediatrician check for hepatitis B. If negative, they offer vaccination for those people who missed the first vaccination somehow. And or unvaccinated adult at risk of getting hepatitis B. This could be lots of people or everyone. Like, if you're sexually active, you think you're at a job where you might be, you can get exposed to blood, potentially infected with hepatitis B, should be vaccinated for those patients. Now, let's say someone has hepatitis B. Then what do? How do you make sure that you are staying healthy, right? First, I want to state that there's no cure for hepatitis B. Unlike hepatitis C, which can be cured, similar to HIV, which cannot be cured, hepatitis B cannot be cured because this is very sneaky virus, meaning that most of the time it's hidden inside your DNA. Do you know your DNA? DNA is your chromosomes, your imprint, genetic material. It's hidden inside, so it doesn't come out sometimes. It can come out. So right now it cannot be cured. However, it can be easily managed, right? How do you manage? You gotta see the doctor properly. Yes.
What is CHB?
Oh, I'm sorry. It's chronic hepatitis B. Chronic. Yes, meaning someone is infected ongoing. So ongoing early detection, proper management is key. Seeing your doctor on a regular basis, getting tested for your liver enzyme, hepatitis B viral count, and checked out for liver cancer. Screening for liver cancer through a test called ultrasound of the liver, as recommended by your doctor, is crucial. And then also educate your peer family member. Say, do not be scared. I'm okay. I can touch my grandchildren. That it's okay to hug and kiss. That's totally fine. And okay. Now, if your doctor decide that, Mr. So-and-so, it's time to offer you medication because we find that your hepatitis B is active, causing damage to your liver. There are many different medications. There are 6 FDA-approved oral medication for hepatitis B. I'm not going to go into detail each one of them, but just know that they're all of them well-tolerated, very safe, very effective to control the infections. Okay, so not to be worried about it, but you need to see your doctor. Okay. I think problem arises when they don't see a doctor. They think, I feel fine. Why do I have to see a doctor? I typically see that problem in younger people. People who are older tends to be more compliant. Other medication include is an injectable medication called Interferon. That's weekly injection. Positive about interferon, there's a chance that you may just get an injection for 1 year. And maybe you may be able to develop antibody response so that you can stop taking medication, period. But it has some side effects. Probably you heard about interferon with hepatitis C, interferon for chemo, there's some side effect, fatigue, vice versa. So now, conclusions. Globally, there's approximately 1 in 30 people worldwide that are living with the chronic hepatitis B. This is 257 million people. In the United States, there are roughly about 2 million people who are chronically infected with hepatitis B. About more than 50% of those people are foreign-born, born outside the United States. Hepatitis B is silent killer. Many people with the chronic hepatitis B feel fine, have no symptoms. Therefore, you should be tested. Your family members should be tested. Those people at risk of getting hepatitis B should be tested for. Hepatitis B is transmitted through blood contact, sexual fluid, mother to baby. And hepatitis B is a manageable disease. Early detection make you live healthy for many, many years to come. And those people who are qualified to be treated, there we have excellent medication to offer, so that they don't progress, develop cirrhosis or liver cancer. So therefore, my final message for today is know your liver, get yourself, your family screened for hepatitis B. Thank you.